Good afternoon, everyone. Let's come to the new session today. So today we will do the hyperosmolar hyperglycemic state. This is basically an acute emergency seen in the type 2 diabetes. So there is an extreme hyperglycemia without any ketosis. So let's see what are the key features and what are the pathophysiology and what are the trigger factors. So in the trigger factors, one of the important trigger factor is any type of the infectious disease, whether it is in myocardial infections or anything. Okay, any type of the infections trigger this hyperosmolarity, hyperglycemia. Second is if there is insulin deficiency or the person skipped his meal or skipped his he didn't skip this insulin injections. Okay, so this is the second cause. Okay, and the third, if there is a severe dehydration and there will be a dye and dehydrated skin, which also lead to the hyperosmolar state. Now, what are the key features you will find? The key features you will find is severe hyperglycemia, where the total blood sugar level is more than 600 milligram per dl. So this is very important for MCQ. What is the total blood sugar level in severe hyperglycemia? It is about more than 600 milligram per dl. Okay, because severe hyperglycemia, the blood because of the high glucose, the water comes out from the cell and the blood becomes more concentrated and it becomes thicker. Okay, it's become more and more thicker. Okay, because of hyperglycemia, as we know that glucose pulls the glucose pulls the water. So that is why whatever the water present in the cell, it leaves the cell and the blood become more concentrated. It becomes more thicker. Insulin is enough to prevent the lipolysis and the ketogenesis, but it is not enough to control the blood sugar level in the body. So insulin is there. Okay, it prevents the lipolysis and the ketogenesis. So that is why ketones is not present, but it's not enough to control the blood sugar level. So that is why extreme hyperglycemia without any significant ketosis. There is a severe hyperglycemia. It leads to the osmotic diuresis, which lead to the dehydration. There is excessive amount of the urine comes out from the urine. The sugar is also coming out. We know that sugar pulls the that is water, that is polyuria is there, and along with it there is an electrolyte imbalance. So when there is an electrolyte imbalance and high amount of the water comes out from the body, the patient may suffer from the confusion, drowsiness, and the later leads to the coma. Okay, because of the water loss and the electrolyte loss. It leads to the increased osmolality, and whenever there is an increased osmolality, it is more than, remember, this is one of the important point to diagnose the one of the diagnostic criteria for the hyperosmolar state, that is high plasma osmolarity, which is more than 320, which is more than 320. Let me write it in another, yeah, in the red pen. So it is more than 320 millisomol. Okay, MOSOM, millisomol per kg of water. Okay, so these are the effect. The brain shrinks and the confusion, drowsiness, and the coma. So this is the hyperosmolar state. It is an acute emergency. So there, how will you diagnose this? The patient will come to you out either with the situation of the drowsiness or the coma. You see the skin, it is dry and dehydrated. Okay, or he was in insulin, or he skipped the insulin, or he has some infections. So these are the trigger factors. And also the blood sugar, when you check the blood sugar level, it is more than 600 milligram per deciliter. Okay, so these are about your hyperosmolar state. So thank you. Let me know what other topics you want in the comment box. Thank you then.